So in this video we will discuss all the muscle, okay, all upper limb muscle and their nerve supply. And you have to remember all the muscle and their nerve supply. This is very important in all exam aspect in everything. Okay, for example, if you see the upper limb, in upper limb these are the most important topic. Okay, so we will start the about the shoulder region, okay, muscle of all the shoulder region and their nerve supply. Then after that we will talk about the arm muscle and their nerve supply, then about the forearm muscle and their nerve supply. Okay, after that the hand and the muscle of the hand and their nerve supply. So you have to write this chart with yourself, and uh, you have to remember everything of this muscle and their nerve supply. Two things, one is muscle and another is nerve supply. So first of all, in the shoulder region there are shoulder region. Okay, so we will first of all we will write about the shoulder region. So in the shoulder region there are different type of muscles. Okay, now first muscle is the trapezius muscle. Trapezius muscle, and trapezius muscle supplied by which of nerve? Trapezius muscle is actually supplied by accessory nerve. Accessory nerve, okay, accessory nerve, and C3 and C4, and C3 and C4. Okay, second muscle is latissimus dorsi. Latissimus Latissimus dorsi. These are supplied by the nerve thoracodorsal nerve. Thoracodorsal nerve. Okay. Thoracodorsal nerve. The third nerve is levator scapulae. Levator scapula. And these nerves are supplied by the C3 and C4 and dorsal scapular nerve. Dorsal scapular nerve. Dorsal scapular nerve. Dorsal scapular nerve. And C3 C4. C3 and C4. Now the fourth muscle is the about the rhomboid minor and rhomboid major. Rhomboid minor, rhomboid minor, and rhomboid major. So rhomboid major, dorsal scapular nerve. Both of them are supplied by the dorsal scapular nerve. Dorsal scapular nerve. Okay. So this is about the shoulder joint. Now we will about let another is the pectoralis minor muscle. 5. Pectoralis minor. Pectoralis minor and pectoralis major. Pectoralis minor and major. So pectoralis minor muscle is supplied by medial and lateral pectoral nerve. Major is supplied by medial and lateral pectoral nerve. Medial and lateral pectoral nerve. Okay. And pectoralis minor is supplied by only medial pectoral nerve. Medial pectoral nerve. So this is all about the muscle of the upper limb connected the shoulder joint, which connect the upper limb with the vertebral column. Okay, the two other muscle are the subclavius and serratus anterior. 6. 7. 7 number is the subclavius muscle. Subclavius muscle. And 8 number is the 8 number is serratus anterior. Subclavius muscle is actually the nerve to the subclavius. Nerve to subclavius. This nerve to subclavius, okay. And serratus anterior is from long thoracic nerve. Long thoracic nerve. These are the nerve. These are actually the muscle of the shoulder joint, okay, of the shoulder and their nerve supply. I have shoulder region, have trapezius muscle, latissimus dorsi, all these muscles. Now the second thing is about the humerus. Now here we will write humerus. Humerus, okay. So in the humerus there are the different muscle. We will write it one by one. Deltoid. Deltoid is supplied by the axillary nerve. Deltoid supplied by the axillary nerve, okay. And another is the supraspinatus. Supraspinatus. Supraspinatus is supplied by the supraspinatus and infraspinatus. Supraspinatus and infraspinatus supplied by subscapular nerve. Suprascapular nerve. Suprascapular nerve. Both of them are supplied by suprascapular nerve, okay. Teres major and teres minor. Now teres minor. Teres minor and teres major. Teres minor and teres major. They are supplied by lower subscapular nerve and axillary subscapular nerve. Teres major supplied by lower subscapular nerve. Lower subscapular nerve. And teres major supplied by axillary nerve. Axillary nerve. So you have to remember that there are these two auxiliary nerve supply, deltoid and teres major. Deltoid and teres major are supplied by the auxiliary nerve, okay. Now the another muscle is about, other muscle is the subscapularis muscle. Subscapularis. Subscapularis is supplied by the upper and lower subscapular nerve. Upper and lower subscapular nerve, okay. So this is about the humerus connected with the scapula, okay. Now we discuss the now let's come to the muscle of the upper arm. Muscle of the arm. We will explain muscle of the arm. So arm have one anterior muscle and one is the posterior side. Anterior is actually flexor muscle and posterior is actually extensor muscle. So anteriorly it have the biceps muscle, three muscle, and posterior it have one muscle in the arm region. Okay. So what is that? Anterior side there is the biceps brachii muscle. So in the arm we will explain it here. Arm, first is the bicep brachii. Bicep brachii, coracobrachialis, 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 okay, and brachialis. Coracobrachialis and brachialis. These are the three muscle. Bicep brachii have one long head and one short head. These three are supplied by the musculocutaneous nerve. So you can remember musculocutaneous supplied to BBC, biceps brachii, coracobrachialis and brachialis. Okay. Now posterior side, this is anterior side. Okay. Anterior side. Now toward posterior side, if you come here to the posterior view, posterior side, posteriorly it have the triceps muscle. Tricep. Okay. Tricep mean tri. So one is the long head, one is the long head, one is the lateral head, one is the medial head, and these are supplied by the radial nerve. Radial nerve. Okay. So this is the muscle of the arm. Now come here to the forearm. Forearm also have one anterior compartment and one is the posterior compartment. Okay. Anterior compartment has the flexor muscle and posterior compartment has the extensor muscle. So now come here to the forearm. About the forearm muscle. In forearm there is the one is the anterior. We will talk about the anterior muscle. So anterior there is the first muscle is the pronator teres, just like pronator teres, and the flexor carpi radialis, okay, and then another is the palmaris longus, okay, and another is the flexor digitorum superficialis, and another is the flexor pollicis longus, other is the flexor digitorum profundus, okay, and the next is the pronator quadratus, so you have to remember that the hand muscle, the forearm anterior muscle is supplied by actually by the medial nerve, except there are some exceptionals. For example, the flexor carpi radialis have one humeral head and one ulnar head. Flexor carpi ulnaris, flexor carpi radialis, flexor carpi palmaris longus, flexor digitorum superficialis, and there is the flexor carpi ulnaris. Palmaris longus, flexor carpi ulnaris. Okay. So flexor Palmaris longus. After palmaris longus, there is two muscle. There is the flexor carpi ulnaris and flexor digitorum superficialis. So flexor carpi ulnaris supplied by the ulnar nerve. Okay, flexor carpi ulnaris supplied by the ulnar nerve. Another is the flexor digitorum superficialis profundus. Flexor digitorum profundus. Flexor digitorum profundus have medial head. Medial, they have two head. Okay, they have two half. Middle half is supplied by the ulnar nerve. Middle half is supplied by the ulnar nerve. Okay, and the lateral half is supplied by the median nerve. So you have to remember these two exceptional: flexor carpi ulnaris and flexor digitorum superficialis medial head. All the other now, all the other, these all others, these all other are supplied by not by the median nerve. Okay, they are supplied by the actually by the median nerve. All the remaining, they are supplied by the median nerve. Median nerve, they are supplied by the median nerve. Okay, so this is about the forearm muscle, forearm anterior muscle. Now we will come here to the muscle of the lateral compartment. There are also lateral side. They may be lateral side, or the lateral side. There are two muscle. Two muscle is the brachioradialis. One is the brachioradialis. Brachioradialis, and the other is the extensor carpi radialis. Extensor carpi radialis longus. These are two muscle to the lateral side. Okay, actually it is to the lateral side, but they are supplied by the radial nerve. Sometimes these also be included in the posterior or extensor compartment, and these all anterior muscle are the flexor muscle. So you have to remember this. Okay, this is the flexor muscle. Lateral compartment is brachioradialis, extensor carpi radialis. They are supplied by the radial nerve. Okay, now toward the posterior compartment. Posterior compartment, posterior compartment. Toward posterior compartment, we will extend, okay, all the muscle. That is the extensor carpi radialis brevis. First is the extensor carpi radialis brevis, extensor digitorum, extensor digitorum, extensor digiti minimi, extensor digiti minimi, extensor digiti minimi. Okay, and extensor carpi ulnaris, extensor carpi ulnaris, extensor carpi ulnaris. Okay, and then there is the anconius. Anconius. Okay, anconius supinator, supinator, anconius supinator. Okay, these are now. Another is the supinator abductor pollicis. Another is the abductor abductor pollicis longus, abductor pollicis longus, and extensor pollicis brevis, extensor pollicis, extensor pollicis brevis, extensor pollicis longus, extensor pollicis longus, extensor pollicis longus, okay, and extensor indicis, extensor indicis. These are the muscles. Now, supplied, these all muscles are supplied by the deep branch of radial nerve. Okay, these all are supplied by the radial nerve. They are supplied by the radial nerve. Okay, radial nerve. So these all muscles are supplied by the radial nerve. Posterior compartment, extensor carpi radialis brevis, extensor digitorum, extensor digiti minima, and these all are supplied by the radial nerve. So you have to remember this. Now we will come to the hand. This is the posterior compartment of the arm. Now we will come to the hand. That in the hand, which muscles are present? Okay. So to the hand, if you come toward the hand, all muscle of the hand, okay, and their nerve supply. Hand have the two nerve come. One is the median nerve and one is the ulnar nerve. So that's why it is sometimes it is difficult. So first of all, hand have four lumbrical muscle, lumbrical, lumbrical muscle is 4 in number, okay, in each hand. Now another is the introshi, introshi, introshi are 8 in number. One is the anterior introshi and another is the posterior palmar introshi. One is the dorsal introshi and the other are the palmaris brevis, palmaris brevis, palmaris brevis. Okay, now you have to remember that the lumbrical. Now first of all we will now short muscle of the thumb are the thumb. Okay, there are 3 thinner muscle and 3 hypothinner muscle. Okay, so the thinner muscle, there are the thinner muscle, thinner muscle, thinner muscle have 3 muscle. That is the abductor pollicis brevis, abductor pollicis brevis, flexor pollicis brevis, abductor pollicis brevis, opponens pollicis brevis. Okay, and another is the adductor, adductor pollicis, adductor pollicis. Okay, opponens pollicis, abductor pollicis, and flexor pollicis brevis. Also there is the not a thinner but it is flexor pollicis brevis. You have to remember these 4 muscles are present here and other are the hypothinner muscle, hypothinner muscle, hypothinner muscle come and they are abductor digiti minimi, abductor digiti minimi, abductor digiti minimi, flexor digiti minimi, flexor digiti minimi, opponens digiti minimi. Okay, these 3 muscle are here. Okay, and they are supplied by the ulnar nerve. Okay, they are supplied by the ulnar nerve. All these muscles are supplied by the ulnar nerve except two. And what are that two? One is the, that is actually lumbrical lateral two, first and second. First and second. First and second lateral two. Lateral lateral two. Lateral two is supplied by the median nerve. Median nerve. Okay. So there are four lumbrical. One is the first, second, that is lateral. That is supplied by the median nerve. Okay. And another is the thinner muscle. The thinner muscle is also supplied by the median nerve. Only these three. These three are supplied by the median nerve. And all other are supplied by the ulnar nerve. Okay. Actually, this is supplied by the ulnar nerve. I have write all the nerve that is present in the palmaris brevis. These are also supplied by the ulnar nerve. In trocei, 8 in trocei, they are also supplied by the ulnar nerve. Okay, so you have to write it. Ulnar nerve. So I write all the hand muscle that is supplied by the ulnar nerve. So it is simple and simple explanation. You have to write these all things and remember. Okay. So if you want to download this chart, I will give a link in the description. So you can download this chart from the link. Okay.